Hello, my name is Amy Humphreys and I'm the Specialist Lead Midwife at South Western Ambulance Service. I was a member of the Guideline Development Group for the latest review and update of the Preeclampsia and Eclampsia Guideline, which sits in the maternity section of JR Calc Clinical Guidance on the JR Calc Plus app. This guidance was previously called Pregnancy-Induced Hypertension, including eclampsia, and we have combined it with the eclampsia guidance that previously sat in the Imminent Birth Guideline, so we have one comprehensive standalone guideline. It has been fully revised alongside the algorithm for management of seizures after 20 weeks of pregnancy and up to 14 days post-birth. This guideline now also advises the use of magnesium sulfate as the first-line treatment for eclampsia and severe preeclampsia as per NICE guidance. These updates have been made to ensure that pre-hospital management aligns with the best available evidence, as well as the pre-hospital maternity decision tool, which should be used together with this guideline and algorithm. The guidance has been simplified to make it accessible and easy to use in time-critical situations and emergencies. We have separated any additional information around these conditions, such as predisposing risk factors, to the further reading section at the end of the guideline. The emergency management of eclampsia has also been reviewed and updated within a new algorithm. Preeclampsia is a multi-organ disorder of pregnancy, and women may present at different times in later pregnancy or post-birth with different symptoms. As we have limited diagnostic tools and treatment available in the pre-hospital setting, we need to have a high index of suspicion for these conditions to enable timely treatment and the best outcomes possible for women and their babies. As ambulance clinicians, we suspect preeclampsia if a woman after 20 weeks gestation or up to 14 days post-birth presents with hypertension and/or signs of organ dysfunction. Early recognition is key, so the pre-hospital maternity decision tool has been incorporated into this guideline, as it outlines the blood pressure parameters that are normal and of concern for this patient group, together with the symptoms of preeclampsia. The decision tool also aids our management here by determining level of urgency. However, clinical judgment should be used to escalate if appropriate. Beyond this, we have provided guidance on what we would treat as severe preeclampsia, which is a blood pressure of 160/100 or more with any of the associated symptoms. If severe preeclampsia is suspected, we would consider treatment with magnesium sulfate if available and escalation to critical care or senior support. However, we must take care not to delay on scene. Important changes to the emergency algorithm for eclampsia is that we treat all current or recent seizures that occur from 20 weeks gestation to 14 days post-birth as suspected eclampsia, even if the patient has a history of epilepsy. Magnesium sulfate is the recommended first-line treatment for eclampsia. It is commonly used to treat active seizures as well as preventing them. There is strong evidence that supports its action in vasodilation, as well as neuroprotection for both the woman and the baby if she is still pregnant. Where magnesium sulfate is unavailable or ineffective and there are ongoing seizures, alternative benzodiazepines should be administered in active seizures. So to summarise, our priorities as outlined in this guideline are to assess, recognising signs and symptoms using the guideline together with the pre-hospital maternity decision tool, to escalate, considering the benefit of critical care, senior support and early pre-alerts depending on level of urgency, to convey promptly to the nearest appropriate unit, minimising delay on scene wherever possible, and to manage both on scene and en route according to scope of practice and local medicine availability, with continuous observation prior to reaching definitive care. We hope that you found this useful. Thank you for listening.